Hello everyone. Depression occurs in women and girls more often than in men and boys since the mechanisms of depression are different in males and females. The following discussion applies to girls more than to boys. We all experience some degree of depressive feelings or lethargy during our life, but the symptoms usually don't last long and we recover relatively easily. And we may repeat the process. However, when you cannot get out of depressive feelings for a long enough time, you may have developed the condition of depression. We perceive external information through sensory organs such as vision, hearing, smell, touch, and taste. We store the information in our memory and we express our thoughts and emotions through speech, actions, and facial expressions based on information stored in memory and information perceived from outside. We may feel good looking at a beautiful scenery and feel bad being criticized by someone. Perception of external information contributes to generating our moods at the moment. Feelings, which females carry and males mostly don't, are generated based on memory rather than perception. Once you have accumulated excess negative feelings in memory, you may perceive every piece of information as being negative and develop depression. Females accommodate stress and store it in memory in the form of wounds to be able to treat them later and generate feelings of happiness when wounds are treated. When they accumulate wounds in memory and cannot treat them properly, their unconscious decides to block perception and expression to protect them from further damage. Children in the phase of adaptation to relationships experience difficulties when they cannot form or maintain good relationships with people well. When problems occur in relationships with parents, siblings, friends, and teachers, they may try to restore the relationship, but when they keep having difficulties, they may give up and choose to stay alone most of the time. They may become unresponsive and avoid interactions. Parents and teachers should keep paying attention to these children and try to have a good relationship with them. Then they will open up and begin to treat their wounds. What adults consider trivial may cause great stress and wounds in children, so adults should be sensitive and considerate in relationships with children in the phase of adaptation to relationships. Differently from younger children, teenagers develop depression based on stress and wounds related with the mismatch of their own thought standards and other people's thought standards. Teenagers are in the phase of formation of self-identity. They are in the process of developing diverse thought standards to be used in their adult life. They may develop depression when they continue to have conflicts with parents and other people due to different thought standards and when they cannot understand the situation rationally. Teenagers have a limited number of thought standards since they have less life experience than adults. They easily feel disappointed when the situation doesn't accord with their limited thought standards. They may also develop depression when they don't make enough expressions outwardly compared with the amount of perception, losing balance between perception and expression. They may express only inwardly and suppress outward expressions and end up developing depression. Children and teenagers are in the process of learning how to adapt themselves to relationships and forming self-identity through forming their own thought standards. They are affected by moods and feelings more easily than adults. Parents and teachers should carefully watch how children are doing, and they should take measures to prevent or address the condition of depression before it progresses further. Especially, the primary caregiver can play an important role in preventing and reversing children's depression by providing them with healthy attention. Also, teenagers themselves can can learn about the operational mechanism of human mind and psychology for accurate understanding to protect themselves.